Good morning, everyone. We talk about the any movements like doing the flexion, bringing the arm front, doing the extension, or whatever the movement we are doing. We are doing in some axis and the plane, right? So whenever like nowadays we are just a clinician, but those who are studying in the academic, they have to remember these name like this movement is happening in particular axis or plane, right? So let's start first the quick discussion of yesterday topic. Yesterday we have learned the basic terminology. कल हमने जो बेसिक टर्मिनोलॉजी की बात की थी एक और मैं क्विकली डिस्कस कर लूँ आपके साथ, राइट? So let's see here. So whenever we are talking about the few terminology like the anterior part of the body means the front, that we know that is the front part, right? The anterior part means front. So we can see this is the front part, right? The posterior part means the back part of the body. Superior means when we are going upper side, inferior means when we are going lower side. Okay. Then I discussed with you, this is the central line, middle line, and when we are going outer side, it is called lateral. Laterally means going outer side. And remember one important thing, this is the anatomical position. What is the anatomical position? We are measuring each and everything in this position. This is the anatomical position. So whenever you want to see anything, this is the anatomical position, right? Not like that. Okay, the arm should be expanded laterally. This is called anatomical position. So this is the medial, and if we are going outer side, that is lateral. तो सेंट्रल लाइन की हो जाएंगे तो मीडियल कहलाएगा, और आउटर साइड की हो जाएंगे तो लेटरल कहलाएगा. So we will be learning lots of term about the medial and the lateral, about the proximal and the distal. So now what is the proximal? Proximal का मतलब क्या है? बॉडी की ओर. डिस्टल बॉडी से दूर. The meaning of proximal, close to the body. So for example, elbow and wrist. Elbow and wrist. Who is close to the body? That will be the proximal. So elbow is the close to the body. So elbow is proximal, wrist is distal. Now I will tell elbow and shoulder. So who is close to the body? Shoulder is close to the body. So shoulder is proximal, elbow is distal. So in the acupuncture also we are telling, okay, this is the wrist crease. From the wrist crease, go to chun proximal, means toward the body. From the wrist crease going to chun distal, so this away from the body. So this is the term we have to use. Then the next term that is called ipsilateral. Ipsilateral means same side, and the contralateral means opposite side. Like in the TCM, we are using the point on the same side. Like in the master tongue, we are using point on the contralateral side. तो हमने कहा कि भाई दर्द कहाँ है, राइट में, इप्सिलेटरल पॉइंट लगा दो, यानी सेम साइड में लगा दो. पेन कहाँ है, पेन है राइट में, कॉन्ट्रालेटरल पॉइंट लगा दो, यानी अगर राइट में पेन है तो लेफ्ट में लगा. इन द टंग वी आर यूजिंग कॉन्ट्रालेटरल साइड. सो इन द वन वर्ड वी आर राइटिंग these are the point putting same side, ipsilateral, or contralateral means opposite side. Okay. Generally we are using ipsilateral concept in the sujug. Same side we are putting it. In the sujug we are putting the point in the same side. So now the important term we are using in the relationship of the so look at here now. So ventral or anterior, we are telling ventral means front side. It's a very common word. We are regularly using it. On the ventral side. Ventral side means front side. So we are telling, okay, nose on the ventral side. Nipples on the ventral side. Navel is the ventral side. Ventral means in the frontal side. अगर मैं heart को, now if I talk about the heart, many people are doing the dissection. So when we are doing the dissection and we are looking the anterior side of the heart, we are telling ventral side. For example, this is my scapula bone. This is my scapula bone. Now I am telling there is a one muscle who is ventral side of this scapula, means I am talking, if we remove this scapula, then we'll get a one muscle on the front side of the scapula. So ventral means front. Ventral means front. We can use for anything. So ventral means front. Suppose this is my heart. This is the heart. This is the heart, right? So whatever I can look from the front side, that is ventral side, and whatever in the back side, that is dorsal side. So this is a very common word. Ventral means front. Okay. Now dorsal means back side. So here it's written ventral means anterior or the flexion. What is the meaning of that? Because generally if you look at the arm, I'm standing in that way. This is the anatomical position. So we can see this is the ventral arm and this is the dorsal arm. So I am telling, because I am doing the flexion here, so I'm also telling the flexion side. Okay, and this is also the flexion side. Flexion means decreasing the angle of the joint. तो हमने कहा कि ये flexion है और यही ventral side है. Then if you look at me back side, I am doing extension. I am bringing my elbow back, I am doing extension. So this is called dorsal side or the extension side, right? So in this way, we have to see these terms. Then we discussed earlier medial border. Medial border and the lateral border. Okay. So it's written medial border lies along the little finger. Okay. So here, this is the anatomical position. If this is the anatomical position, I told you the from the mid near the midline, that is medial, away from the midline, that is lateral. So whatever is happening, this is the medial and this is the lateral, right? So this is the medial toward the midline. Now tell me, little finger is medial or lateral? Comparison with the thumb. अगर मैं लिटिल फिंगर के बारे में पूछूं थंब से कंपेयर करके, तो लिटिल फिंगर मीडियल है या लेटरल है? लिटिल फिंगर मिडलाइन की ओर है कि दूर है? सो सो लिटिल फिंगर इज लिटिल फिंगर as per the anatomical position here. So as per the anatomical position, in this way we can tell the little finger is medial. Remember only, because in the anatomy this position is important, and that is called anatomical position. Look at this position. This position is very much important in the anatomy. Whatever coming toward the midline, that is medial. Whatever away from the midline, that is lateral. Is it clear? Okay. So now we are coming to the joints movement. We already have seen this is the flexion, right? हमने कल बात की थी कि ये flexion है. Flexion means we are decreasing the joint movement. Give me. Okay. So whenever we are decreasing the joint angle, that is called flexion. We already have discussed yesterday. Now, when we are taking the joints away, that is called extension, right? We discussed yesterday. Look at here. So here, when we are taking back, that is extension, decreasing the joint angle, that is a flexion, increasing the joint angle, that is extension. तो जब हम बाइसेप्स ट्राइसेप्स की एक्सरसाइज करते हैं तो देखिए बाइसेप्स ट्राइसेप्स flexion, extension, again biceps, triceps, decreasing the angle, increasing the angle. So this is called flexion and extension movement. Now let's move to the abduction. Ab means away. The meaning of ab means away from the body. So if we want to understand the abduction, means movement of the bone away from middle line, उसे हम abduction कहते हैं. तो फॉर एग्जांपल कल हमने ऑलरेडी बता ही दिया था, लेकिन दिस द क्विक रिकैप, राइट? Any body part, suppose if I'm taking my arm away, that is abduction. I am bringing it back, that is ADD, adduction. Taking away, abduction. Taking it back, AD means adduction. For anything. No. Adduction means adding, bringing near. That is adduction. Like see, what is adding? What means add? Add means you are adding something. So I am adding my arm with the body, that is adduction. For example, I also has told you about the legs yesterday. Suppose these are my legs. So what is abduction here? A abduction means abduction, taking it away. Abduction, abduction. Okay. Now bringing it back, that is called adduction or adduction. So anything, taking my finger away, abduction, abduction, and taking it back, that is adduction. Yes, yes, right. So adduction means bringing it near. So it's written here, movement of the bone toward the midline, that is adduction. So now we can see here, lots of muscles are doing this movement to take the bones away and bringing them near so that we are able to do this movement. Now there is an internal and external rotation. So for that we have to see this. Now if we see this, when we are bringing something near, so we are rotating the shoulder joint here, we can see. So we are bringing inner, that is called inner rotation or the medial rotation, and when we are taking it out, that is called lateral rotation, right? So here the internal rotation means what is written, when the upper limb is turned toward the midline, right? Toward the midline. And that is called internal rotation. And when it's turned away from the midline, that is called external rotation. So look at here. Suppose I am doing this movement. I am doing this movement. You can see, I do this movement. So this, something is happening here. You can keep the palm here. Now you see this, what is happening here. You can feel the rotatory movement here. So when I am bringing the shoulder in the medial side, on the inner side, it's called internal rotation. And when I am taking it to the lateral side, then I can feel the movement here, that is called lateral rotation. Can you feel the movement here? Try to touch this part and try to feel the movement here. Because patient is coming to you, you know that it's a very beautiful thing that for every movement, different muscles are involved. So patient coming to you, doctor, can you treat my shoulder pain? Yes. We are telling them, okay, do this movement. Pain, no pain. Do this movement. Yes, yes, paining. Wonderful. Now we can tell, okay, these two muscles are responsible for this movement. So we have to treat these two muscles because every movement is made by a different group of muscle, right? Accordingly, we can find out the which muscle are involved. The patient will tell you, doctor, I'm suffering with a shoulder pain. I feel only when I do this movement. Only when I am sleeping and I do this movement, just I feel the pain. I can't feel pain in any other movement. Means certain group of muscles are stiff or in the spasm. केवल कुछ ही मसल को का स्पाज्म है, तो हमें उन मसल्स को फाइंड आउट करना है और उसका ट्रीटमेंट करना है, राइट? सो दिस वाज द external rotation and internal rotation. Now apposition of the thumb, right? What is apposition? गिनती कैसे गिनते हैं? गिनती कैसे गिनते हैं? गिनिए जरा. 1 2 3 4. So you can see the thumb is going and touching the every finger. This movement is called apposition of the thumb, right? opposition of the thumb. Now supination. Supination already I've discussed yesterday. कल हमने बात की थी supination की. Look at this image here. So supination means when the palm facing upward, means palm facing in the upward direction, that is supination, and when it's going downward, that is pronation. There are two words, supination. So we can see this is the supination when the palm is facing upward. Like जैसे आपको खाना खाना है, as in the putting the food in the mouth, you want to put the food in the mouth, so palm is upward, that is supination. And what is the pronation? Pronation when the finger toward the plate, picking the food. Okay, picking the food when our fingers are downward. हम कोई भी चीज उठाते हैं तो हमें पहले प्रोनेशन में अपना हाथ करना होता है. I want to lift anything, so my hand will be in the pronation, like I want to lift this. See, so my hand in the pronation. Now I want to give to someone. Okay, take it. This is the supination. So pronation, supination. So this is the movement that is called supination and pronation. Eating the food, I am picking the food, that is pronation. Then eating the food, that is supination. So regularly I am doing this movement and this movement, supine, prone. In this way we can understand this movement. Okay, so now the ankle plantar flexion. अब हम ankle के plantar flexion की बात करते हैं. Let's see here. First, let's talk about the dorsiflexion. Now we'll be coming to the plantar flexion. This is the plantar flexion. Okay, this is the dorsiflexion. So now next the plantar flexion. This is the plantar flexion. So the meaning of plantar flexion, increasing the angle. We can see there are lots of angle increase in the plantar flexion. जो हाई हील पहनते हैं, तो हाई हील में पैर कौन सी पोजीशन में होता है बताइए. So this is the high heel. This is the high heel or dorsiflexion. High heel. No, sorry. जो high heel होता है उसमें ये पैर होता है, right? This is the position in the high heel. And this position is called, this is the, please don't read this here. This position is called plantar flexion. Is it clear कि हाई हील में क्या होता है? Plantar flexion. होता है कि नहीं? है ना? And remember one thing, heel is the area who can disturb entire biomechanics till the head region. पैर में कुछ होगा उसका प्रभाव सिर तक पड़ता है, including each and every part of the legs, means the knee and the hip region, cervical spine as well as the head. So the plantar flexion means when the high, means the high heel shoes or the sandals. So in this way, if we look at these two, look at here. So this is the dorsiflexion. Okay, we can see that joint ankle is reducing. Okay, so when the sole of the foot is coming near, and this is the dorsiflexion, this is the dorsiflexion, and this is the, so look at here, I will show you once here. Now tell me, I'm asking you, what is this? Which is this movement? This is the plantar flexion, right? And what is this? This is the dorsiflexion, right? Now tell me, what is this movement? This is the plantar flexion. What is this movement? This is the dorsiflexion. Now suppose if I am doing this, can I walk like this for 1 hour, 2 hour? What will happen? अगर मैं 2 घंटे ऐसे घूमूं तो क्या होगा? पूरा कमर का बायोमैकेनिक्स ही बदल जाएगा भैया। तो यही तो होता है हाई हील में। फिर लोअर बैक टिल्ट हो जाता है। सो there might be many problems. Now the next word that is called inversion and eversion. There are two words, inversion and eversion. In means अंदर की ओर, e means outer. The meaning of e means outer. The meaning of in means inner. So look at here. The meaning of inversion. Patient will come to you and be walking in a very different way. Patient walk करेगा but अलग अलग ही type से. Look at here. Like this. You can see. So this is the normal position. But if I am doing like this, see my leg is turning inward. That is called inversion. Okay. Like this. Inversion. See, both are inverted. Inversion means leg is going in. That is inversion like this. So many person are giving more weight on this inner part. Maybe they are doing very little, not much, little. This is also inversion. Maybe only one leg. And when you are keeping the weight outer side, that is eversion, E. Definitely, the patient will not come to you like this, but the patient will be giving more weight to the lateral side. So inversion means when you are keeping turning leg in, that is inversion. When you are turning leg outer, that is eversion. When you are encountering with any neurological patients, this is a very common pattern. You can see the walking pattern. आपने देखा होगा कई जो न्यूरोलॉजिकल प्रॉब्लम के पेशेंट होते हैं उनको वॉकिंग में थोड़ी उनकी they are having different types of the walking and they are having problem in the eversion or inversion. You can see the leg, oh, this person is having inversion. Inversion means when you walking, turning the leg toward the inner side. Is it clear? I have encountered with the same patient. Parents asked me, if this is my child is walking in a very different way. Then I asked him, what is the problem? Okay, he got some accident and got some accident in like brain injury. After that, he walk in this way only. So this is a neurological connection. But we have to find out and accordingly we have to plan. So look at here. So when the leg is going outer side, that is eversion, inner side, that is inversion. Let's see next. When we talk about the muscles, what is the origin and what is the insertion, right? So origin means where the muscle starts, insertion means where the muscle ends. That is origin and insertion. Okay, so remember one thing, muscle are doing movement on the insertion, कि मसल की जो मूवमेंट होती है वो इंसर्शन पर होती है. फॉर एग्जांपल, one muscle is starting from here, that is called origin, like the biceps muscle. Then this muscle is doing insertion here, means ending here. So this muscle will do the movement on the ending here, right? So origin part is fixed, and insert where the muscle is inserting, the muscle is moving that part. उदाहरण के लिए आप कुएं में से पानी निकालते हैं, है ना, तो आपका हाथ तो वही है ना रस्सी में, but bucket is moving when you are taking out water from the well. So origin means जहां से रस्सी स्टार्ट हो रही है वो तो भाग उधर ही है, फिक्स है, लेकिन बाल्टी हिल रही है, मूव हो रही है, अपनी ऐसे ऊपर जा रही है, ऊपर जा रही है. So when we are taking out water from the well with the help of bucket, our hand and the upper part is fixed, upper axis fixed, that area only. We will just doing that there only, but the bucket is changing their place. So muscles where it's taking origin, it is a fixed, but it's changing the but it's changing, it's moving the area, moving the bone at the insertion. जहां पर इंसर्ट होती है वहां को मूव करती है. Now muscle belly, we can see, जैसे हमारी belly हम जानते हैं ना, we have belly, big belly. In the same way, muscle is the thicker and bigger part, middle part of the muscles is called muscle belly. Okay. So now we can see the muscle is ending, that part is called tendon, because now muscle is ending with the tendon, right? Tendon is the structure who connect muscle with bones. हमारे शरीर में एक बहुत कॉमन टेंडन है जो हम बार बार सुनते हैं. क्या नाम है उस टेंडन का? What is the name of tendon? We hear the name again and again. Tendinitis. What is the name of that tendon? Achilles tendon. Achilles. Have you heard the name Achilles? मर्म शास्त्र में पहले जो the people who used to fight क्या करते थे कि अपने शत्रु का एचिलिस टेंडन काट देते थे. एचिलिस टेंडन कट कर दिया ना, सामने वाला हिल भी नहीं पाएगा. Even the person will not able to move if you cut the Achilles tendon. This is the Achilles tendon. So this is very important. It's very hard. You can see. Can you hold this? It's a very hard structure. Achilles tendon. You can see without Achilles tendon you can't move your leg. It's a calf muscle. There's the calf muscle. Then there's the Achilles tendon. Then there is a fascia here. All are connected. If this, you can imagine, if this is injured, what will be the movement? Okay. So what is the tendon? The meaning of tendon means this is the muscle. Muscle is ending. Then this is the tendon. So tendon who is connecting muscle with the bone, that is tendon. टेंडन का मतलब है जो मसल को बोन से कनेक्ट करे, और टेंडन इज वेरी टफ स्ट्रक्चर. टेंडन्स आर वेरी हार्ड एंड टफ स्ट्रक्चर. So this is called fibrous. Fibrous means very tough and hard, non-contractile. ये contract नहीं होते structure. Okay, so now, and with these we know what is the artery, what is the vein, and what is the capillaries. Okay, now my next target I want to discuss with you. This was the basic terminology we already have discussed yesterday, कल भी हमने इसकी बात की थी. Now we will be discussing again some basic terminology, because whatever we are discussing, hip joint or the knee joint, this basic terminology are very common in you. So there are three planes and three axes in the human body. हमारे शरीर में तीन प्लेन होते हैं और तीन एक्सेस होती है, right? So we look at here, it's a very simple concept, the concept of axis and plane. This is also basic thing, right? Okay, so how to understand this? इसे हम कैसे समझें? इसे समझने के लिए हम करते हैं, चलिए, we'll take one example. So look at this. Because we are discussing each and every body part in the reference of axis and plane. Let's talk about the plane. So what I am doing now, like हम जैसे प्याज काटते हैं, we are making the slice of onion. So if I slice this and I remove this part, slicing this like onion. Okay, so suppose this is the onion and I'm slicing and removing it. This is very important, because if you want to see what's here, then this is only the option. So this is called transverse plane. What is the name of this plane? Transverse plane. Is it clear? Transverse plane means who are dividing body in upper and lower part. Are you able to understand, or it's complicated? Just cutting the body like making the slice. In the transverse plane now, all the structures are visible. All the structures are visible. So now repeat my sentence. It's very important, which I'm going to repeat. Or you write in the chat box. Transverse plane means who divide body in two parts, upper to lower, upper and lower. Is it clear? The transverse plane who divide body into part, upper and lower. We can see here. The transverse plane who is dividing the body into half, this is the upper and this is the lower. Now upper and lower is clear. So we can see two parts, upper and lower. Is it clear? Very good. Now, again, axis. Axis we'll discuss in the last. You will. Okay, so now the second plane. Okay, transverse plane divide body in the upper and lower. So we can see nowadays when we are doing MRI. In the MRI, suppose you want to see each and every part, so they are taking in the transverse plane also. There are multiple planes they are taking. Then we can see, oh, what's happening here. So tell me. So look at, this is the vertebra. Can you see this is the vertebra? This is the spine, because this pointed part on the back side, we can feel. You can feel your back part that is pointed. So this is the pointed part. who is on the back side. But I want to study what's happening here. यहाँ पर क्या गड़बड़ है, मुझे वो देखना है. So what we'll do, we will make the slice. Then we can see this part. So we can study everything like the disc of the vertebra, the outer covering of the vertebra. I can see each and everything why in this transverse plane. So transverse plane play very important role. Is it clear or not? Clear? Now there are two more plane. The another plane that is called sagittal plane. My favorite example. वो शिवाजी महाराजा की तलवार. शिवाजी महाराज ने तलवार ली और कितने 160 किलो की तलवार थी. कितने किलो की? 160 kg की. हम उठा लेंगे इसी तलवार को? रत्न पारखी जी जरूर उठा लेंगे 160 kg की तलवार को. रत्न पारखी जी, शिवाजी महाराज की तलवार का वजन था 160 किलो. हम तो 60 किलो भी नहीं उठा पाते और वो तो तलवार लेके मारते थे लोगों को 160 किलो. So cutting the body in two halves from up to down, that is called sagittal plane. उसे हम sagittal plane कहते हैं. Sagittal plane means when we are cutting the body from the central. शिवाजी महाराज ने अपने शत्रु को तलवार मारी थी यहां से, तो उसकी बॉडी के साथ साथ घोड़े को भी दो भाग में काट दिया था, है ना. They have cut the body of the opposition. Even the horse, both are divided in two parts. One part this side, one part this side. One yin is that side, yang is that side. That is sagittal plane. So what we can see in the sagittal plane now? अब हम sagittal plane में हम क्या देख सकते हैं? Right and left. We have divided the body in the right. Can you able to imagine that thing in your mind? Imagine कर पा रहे हैं? So in this way, I can do the, suppose you just imagine, if you are cutting the body in two halves, what will you able to see? आप क्या देख पाओगे उस कटी हुई बॉडी में? What you can see? What will able to see? You can see all the structure from the side, right? You will able to see. So when you want to study all the structure from the side view, you can cut the body in the two halves. That is called sagittal plane. Yeah, got it? The third and the last plane, that is called frontal plane. लक्ष्मण जी ने सुपर्णखा की नाक काटी थी frontal plane में. Frontal plane, right? Now suppose if you are cutting the nose in the frontal plane, what will you able to see? Remove the nose, then you can see all the structure here: nasal concha, the inner bone, ethmoid bone, frontal sinuses, right? In the same way, if you cut the body from the here, like this, slice, a frontal slice, what are you able to see? So frontal plane, who is dividing body in the two parts, front and back. Is it clear? Front and back. Now suppose if you are cutting the body from here, what you will able to see? You will able to see, just you can do the imagine what you able to see if you're cutting the body in the front and back. So now you have to remember three things. Number one, frontal body dividing, frontal plane, dividing body in two parts, front and back. Is it clear? कि फ्रंटल प्लेन बॉडी को दो पार्ट में बांट रहा है कि सुपर्णखा की नाक अलग गई, वो फ्रंटल, और पीछे का पार्ट पीछे रह गया, दैट इज बैक. So frontal plane is dividing body into parts, front and back. The sagittal plane dividing, शिवाजी महाराज की तलवार, the sagittal plane dividing body in the two part, right and left. Is it clear? Now transverse plane like slice, हम जो प्याज की slice काटते हैं, transverse plane, onion slices. The transverse plane dividing body in the horizontal pattern means right to left, right to left. That is the transverse plane. Is it clear? Is it clear? Excellent. Clear to everyone? Clear? Okay, wonderful. सबको समझ में आ गया ना? Good. Okay, done. समझ में आ गया तो बहुत अच्छा है. Now we have to discuss axis. Now if this much is axis, then you will able to understand very clearly. Now my question from you, tell me. Let's start from the frontal plane. Tell me frontal plane dividing body in two parts. What is the name of that two part? कि frontal plane हमारी बॉडी को दो पार्ट में डिवाइड करता है. Frontal plane, सुपर खां की नाक. What is the name of that two? Tell me. Write down. So I will show you here. Let's see this. Same thing I'm showing you here. Can you see this? The frontal plane dividing body front to back. Is it clear? Front to back. Okay. Now I will take how to make the axis. Now I am taking this. Now if we talk about the axis, now first I'm talking about the frontal plane. I'm just talking about the frontal plane. So the line number 1, frontal plane divide body in the front to back. Is it clear? Is it clear? Axis. Axis in the frontal plane going front to back. Front to back. Axis in the frontal plane going front to back. Because axis always go 90 degree. If I want to do this movement, the axis will go 90 degree. So frontal plane dividing body in the front to back, axis also going front to back. Front to back. Is it clear? What is the name of this axis then? If the axis is going like this, front to back, what is the name of this axis? We'll discuss in the last. We can understand, yeah. Front to back, or we can tell simply anterior posterior axis, right? Front to back axis. Okay. Now, second. Now, Shivaji Maharaj ki talwar, sagittal plane. Dividing body side to side. Am I right? Side to side. Is it clear? Look at here. So sagittal plane divide body side to side because we are cutting body in two parts. So look at here. The axis in the sagittal plane also going side to side like this. Side to side. Whatever the name we'll discuss later on. So remember, the sagittal plane dividing body in the two parts side to side, axis also going side to side. Now third, transverse plane. The transverse plane means slicing, onion slice. It is dividing body in the up and down, right? Up and down. Axis also go up to down, right? Up to. Tomorrow we'll discuss this thing for 5 minutes, then we'll move. And after completing the basic terminology, then we'll be moving toward the hip joint, which we have started. Thank you so much. See you tomorrow. Have a wonderful day, blessed day. Let's close this.